My friends, today diabetic is no longer a small issue. It's a global crisis. According to WHO, there are 800 million of people suffering of diabetics in the world today, and 3.5 of them die every year because of the same disease. And what's more worrying is that today diabetic is no longer an adult disease. Children are suffering from that because our lifestyle have changed. We add a lot of processed food, rise of the food chain franchise that sell processed food contribute one of the factors. My name is Dr. Ray Wong from Dr Arafitco. I come from a background of food science, wellness, and beverage innovation. Today, my friend, I'm going to share with you good news. Today, I'm going to give you good hope. If you are diabetics, you may hear about this statement: you need to take medications the rest of your life. That means you need to take medication until you die. Have you heard this before? The real question is that, do you agree on this statement? Today, I want to bring you a different understanding. Today, I want to bring you a good news, because improvement is possible. Your condition can be helped. Your future does not have to be hopeless. Now, when a diabetic see a doctor, they are very familiar with this term we call insulin resistant. So, what is insulin resistant? If I break down in a very simple word, the word resistant means rebel, reject, refuse. Now, what is the body refusing and rejecting and rebelling? Insulin resistant means that the body is resisting insulin. Yeah. So, insulin is the key that open door that allow glucose to go into our cell to convert into energy. Now, but what happens if our cell is full? When our cell is full with glucose, our cell already overloaded and our cell say to insulin, nope, I'm not opening my door to you. Yeah, and now I resist. Yeah, and I do not want you insulin anymore to come into this cell. So that is insulin resistant, when our body stop responding to insulin. And sugar is not the root cause. Sugar is barely the symptom. The root cause is this insulin resistance. My question to you, what is the medication that you are taking? Is the medication allowing you to increase your insulin, or the medication is reducing your insulin? Or you have no idea what is it all about? My friends, I need to share with you, this is very, very critical and this is very important. When our cell keep rejecting insulin, however, we are still taking and consuming food that is high glucose, what happened? Yeah, our pancreas will keep pumping insulin. What happened? Our cell can't take it, so our cells somehow will leak out the glucose. And where the glucose go? Now, when the glucose go to the eye, somehow it may create something we call glaucoma. When the glucose flow to the brain, we may experience dementia. So these are all a lot of complicated things that one overdose of sugar, glucose, is happening in our body, is affecting us as a diabetic patient. Insulin overloaded and it becomes resistant. Now, the fear are planted in many diabetics. The diabetics are told upfront, when you have this, you may have the coming side effect. Now, over time, this fear become normal, expected, inevitable, and it's expected. If this thing happen, they already anticipate. Yeah, so these are the side effects. Now again, come back to the question that I asked. Do you agree on this? The turning point, the questions of choice. My friend, is very sad to hear the real question. Will you accept this as your destiny, or will you reject and seek a better way? Now, educations bring awareness. Awareness bring better decisions. And today, again, I want to share with you a good news. I want to share with you a new hope, a new perspective, a new understandings, and I want to introduce you Dr. Arafitco Maringga Mate. Let me briefly explain what is Dr. Arafitco Maringga Mate. Yeah, it's a functioning wellness beverages. It's not a drugs. It's developed using science-based food biotechnology. The formulation is built around 3 well-balanced ingredients. We call it a 3 superfood, which is the moringa, the yerba mate, and the matcha. So when we're talking about the moringa, it's often referred as a nutrient-dense superfood, naturally rich in polyphenols, antioxidant, micronutrients, traditionally studied for metabolic support, anti-inflammation potential. And the yerba mate, is known for high antioxidant capacity. Again, polyphenols, supporting energy metabolism, helping regulate glucose response. And the matcha, is from the whole green leaf tea, and it contains the catechins such as EGCG, and antioxidants and polyphenols, again, widely studied and supporting metabolic balance, reducing oxidative stress. These are the superfood we're talking about in the Dr Arafitco Moringa Mate. And what is so unique, we have mentioned, biotechnology. That makes it different. Why antioxidant and anti-inflammatory support so important, and why does it matter? Chronic metabolic conditions are often associated with oxidative stress. Low-grade inflammation diet in antioxidant polyphenols are widely recognized as supportive overall metabolic health. If this topic is useful to you, and if you would like to learn more about the science approach behind Dr Arafitco, feel free to leave a comment below. I personally read them and will share with you more contents about that. Again, diabetic is not just about sugar, it's about metabolic health. The right knowledge, you need to gain clarity, you need to regain hope, and hope change decision. Thank you for watching. This is Dr. Ray Wong from Dr. Arafitco, and disclaimer, now this video is for educational purpose. It does not replace medical advice. Please continue working with your doctor. We'll see you again.